Hi everyone, my name is Sarah Monahan Cunningham. Today I'm going to be talking about a new story from Reuters titled Wildfire Smoke Exposure May Shorten Lung Cancer Survival, published on May 31st, 2025. It's based on a study that looked at how wildfire smoke affects not just cancer risk but also survival for people who already have lung cancer. The study found that lung cancer patients who lived in areas with more wildfire smoke don't tend to live as long. Researchers from UC San Diego looked at data from over 300,000 patients across the US. They found that even small increases in wildfire smoke pollution was linked to lung cancer patients living about 16% shorter lives than those with less exposure. People who were exposed to smoke both before and after their diagnosis, had the worst outcomes. That shows that air quality plays a huge role for not just getting sick, but also in recovery. What really stood out to me is that this isn't just about preventing cancer. Wildfire smoke can actually make survival worse after someone's already diagnosed. It's a reminder that where you live matters. People in smoky areas had worse outcomes, even if they got the same treatment. Not everyone has the money to buy air purifiers or leave town during fire season, so this raises health equity concerns. On a personal note, this story hit home for me. My significant other is a firefighter, and this puts him at higher risks for cancer. Thankfully, his department offers yearly cancer screenings, which is a good example of secondary prevention, catching illness early to improve outcomes. The article is based on a study published by JAMA Oncology. Researchers looked at nearly 467,000 patients who had lung cancer between 2004 and 2019. They used zip code data to track who was exposed to wildfire smoke during their recovery periods after surgery. They found that people exposed to smoke in the first 3 months after surgery had a 43% higher risk of death. So, wildfire smoke didn't just increase cancer risk, it also made recovery much harder. There were a few gaps and limitations. The article didn't mention who funded the study or whether the researchers had any conflicts of interest. It also didn't explain how they measured smoke exposure for each person. We don't know if certain groups, like rural or low income patients, were more exposed than others. And while the article does a good job of summarizing the findings, it doesn't include any charts or technical details from the study. The study raises a lot of important questions. How does smoke exposure compare to other survival factors like genetics or cancer treatment? What strategies actually help? Things like HERPA filters, staying indoors, or relocating. Did the researchers study how race, income, or location might have affected exposure levels? And finally, what can public health agencies or policymakers do to reduce the risk for people recovering from cancer during wildfire season? This connects directly to what we've been learning in PBH 101. It ties environmental health to chronic disease, especially cancer, like what we talked about in chapters 3 and what we will talk about in chapter 14. It also highlights the social detriments of health. Where you live and what you're exposed to can affect your outcome, even if you have access to care. Here in Reno, Tahoe, we know how bad wildfire smoke can get. It's a real local concern. This story also shows how the three levels of prevention come into action. Primary prevention means reducing wildfire risk and improving air quality. Secondary prevention includes cancer screenings for high risk groups like firefighters, and tertiary prevention involves supporting recovery with clean air, housing, and medical follow up. Thank you for listening. Any questions or thoughts? I know this can be a hot topic for where we live.